Welcome to Tuesday's edition of COVID-19. Korea's daily tally is holding steady on the 700 level with little sign of abating. And this, of course, is the reality for most nations worldwide amid the shortage in vaccine supplies. Now, accordingly, some developing nations have been taking matters into their own hands. And we have details on that later on in the program. Here first is the broader pandemic coverage with our Kwon Soa. Now, Soa, do start us off then.
Sure, Sunny. Following a drop by around 30 cases on Monday, we're seeing about the same number of cases having been added to Tuesday's tally, with 746 cases reported as of 12 a.m. And with that, the number of domestic transmissions has risen to the high 600s, with a slight drop in imported cases to the 50s. And with that, Korea has a total of 161,541 cases, and also 4 additional COVID-19 related fatalities have been reported in the past day. Now, since last Wednesday, we are seeing infections have been in the 700s or even in the 800s, which is raising concerns here, especially the proportion of the infections in the metropolitan region. Here in the capital, Seoul, for most of this month, this number has been in the 300s. And newest clusters broke out at a workplace as well as an indoor gym. And in Gyeonggi-do province here, at over 200 cases, there were new cases confirmed at a daycare center, as well as additional cases linked to a gathering among English language teachers. And also here in Incheon, concern over 20 elementary students have been confirmed with the virus, with screening centers, emergency walk-in screening centers. They are testing some 3,000 people, including teachers and students. Now, given this situation, Prime Minister Kim Boo-kyum, at an interagency meeting on the situation in the greater Seoul area, said on Tuesday the country is currently at a critical juncture, not only due to the fast spreading of the virus, especially among younger people in their 20s, but also due to the emergence of variants in the capital region, stressing that more needs to be done.
We will have to contain the virus with the determination of repaying our citizens who've been cooperating with health authorities for a year and a half, in spite of the difficulties in their daily lives, such as wearing masks. And we must regard any failure to stop the spread in the capital region as a sin to our nation's people.
And with that, the Prime Minister stressed that compliance to prevention measures at various settings will be decisive in containing the virus situation. A one-strike rule involving 10-day business closures will go into effect Thursday for businesses that violate antivirus rules. That will also be the day when the metropolitan region will be under new social distancing measures, whether that means under the revised social distancing scheme, an extension of current rules, or stronger measures is set to be announced on Wednesday.
Right, Wednesday, which is tomorrow. Meanwhile, on a positive note, so I hear Korea and Israel have signed a vaccine swap deal.
Right, Sunny. Israel is to send around 700,000 doses of Pfizer vaccines in the coming days for swift use here in Korea. And according to this win-win deal, Korea will send back the identical amount of doses later in autumn. And the Korea Disease Control and Prevention Agency is likely to have more details on this exchange in its later briefing. But before that, let's take a look at the numbers of vaccinations here in the country. We have hit a milestone of 30% of the nation's population who got at least one dose of vaccine, and that's 15.4 million. Now, meanwhile, over in the UK, which is citing its high vaccination rate and the low death toll compared to the number of COVID-19 infections, British Prime Minister Boris Johnson declared to terminate COVID-19 lockdown measures on July 19th. Rules on social distancing and mask wearing are to be scrapped, and also businesses, even nightclubs, are going to operate as normal. But a final decision is slated for next week. Last but not least, let's take a look at the numbers here. The UK saw some 27,000 new infections, raising the total to above 4.9 million. And we've got South Africa with over 29,000 new cases, having surpassed the total caseload of Peru. And the total number across the world stands at 184.9 million. And here, another milestone, 4 million COVID-19 related deaths. And those are the updates I have for now. I'll see you back after the briefing. Back to you, Sunny.
All right, so thank you for now. Right, back on the local front, vaccination efforts for the second half of the year are on track with cross-inoculation on the agenda for those who received a first dose of the AstraZeneca vaccine. Now, for more on this, I have our Kim Do-yeon here in the studio. Welcome, Do-yeon.
Hi, Sunny.
Right, so people who got an AstraZeneca shot first are now up for the Pfizer shot as their second dose.
Right, Sunny. Age restriction for AstraZeneca vaccine have gone through many changes over the past few months due to safety concerns. The latest, which came into effect last week, makes the vaccine available only to people over 50. But by now, many of those under 50 have already gotten AstraZeneca vaccines for their first dose. And health authorities have approved the use of Pfizer vaccines to be administered as second jabs for these individuals. Some 950,000 people are eligible for cross-vaccinations, otherwise known as mix and match shots. The government reassured the public that cross-vaccinations are safe, citing precedents in other countries. But it's not letting its guard down.
We will strengthen our monitoring of any adverse reactions to the mix and match shots by checking on the 10,000 people who are receiving them, by communicating with them through text messages.
Right, and Toyin, what is the latest with regard to post-inoculation adverse reactions?
Sunny, there are no new deaths with a causal link to the vaccine reported since the one they announced last week. Coming on the screen now is the rate of suspected adverse reactions reported for each type of vaccine. Side effects were observed in 0.63% of all AstraZeneca vaccine recipients, followed by Moderna at 0.49%. and Pfizer at 0.24%. Adverse reactions were most prevalent among people in their 30s, and 95% of all cases involved common and mild post-inoculation symptoms. Health experts did sound off a warning, however, that the country may witness a growing number of reported side effects as it vaccinates a broader segment of its population in the third quarter.
I would like to bring your attention to the type of vaccine we are planning to use in the third quarter. From now on, we will mainly use mRNA vaccines, which, as we mentioned on numerous occasions since the beginning of our inoculation drive, carry a higher risk of anaphylaxis compared to other vaccines.
Right. Meanwhile, Toyin, I hear prevention protocols for those who've come into contact with an infected individual have been eased for those fully vaccinated.
Right, prior to Monday, even fully vaccinated people had to go through 3 PCR tests in a span of 2 weeks if coming into a contact with an infected individual. Now, that's been lowered to a single test after a week of contact. Also, they will not be actively monitored by health authorities, and the individuals are only required to contact their local community health center if symptoms arise.
What is, Toyin, the testing requirement then for fully vaccinated people arriving into Korea, flying into the country, that is?
Right. Sunny, incoming travelers had to take 4 PCR tests when coming to Korea, including 1 prior to their departure. But now, only 2 are required. Once within 72 hours before their flight and once after a week of landing. But do keep in mind that entry restrictions will not be eased for passengers flying from countries with a serious outbreak of variant infections. Also, anyone who does not take the required PCR test will be required to spend 2 weeks in quarantine. So follow these guidelines to the letter.
I see. All right, Toyin, one final question. I understand authorities are looking to acknowledge the inoculation status of those people who received 1 dose of the vaccine here in Korea and a 2nd dose overseas. Can you tell us more about that?
Right, Sunny, the government is looking to strike an agreement with other countries and devise a system to verify authenticity of vaccine certificates issued abroad. The government says it will accept vaccine documentation from other countries based on the principle of reciprocity. Once the system is in place, it'll open the door to many possibilities.
We will broaden our criteria on who should be categorized as being fully vaccinated, so that anyone who got his or first dose in Korea but received the 2nd dose in another country will also be regarded as being fully vaccinated.
All right, Toyin, thank you very much for that.
Thank you.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Tuesday.
And we also have officials from the Foreign Ministry and also Commissioner Chung Eun-kyung, and we also have other officials present today. And we will also be briefing you on the latest on the vaccine swap deal. Good afternoon. I am Commissioner of the KDCA, and before we begin our regular briefing, let us brief you on the Israel and South Korea vaccine swap deal that has been reached. And our TF team has agreed on that in July we will be receiving about 700,000 doses of Pfizer vaccines from Israel, and we will be returning these amounts in a consecutive manner in September and October. And this has been reached today. And here in South Korea, we also have a cold chain that can distribute these Pfizer vaccines, and we also have the adequate infrastructure to provide the 700,000 doses of vaccines to our public, and we can also accomplish and complete the vaccination drive going forward. And this is the background of such a vaccine swap deal. And the two countries, based on our trust and mutual trust that has been developed for the past years, we have also been discussing as members of the COVAX facility, and we have been engaging in continued negotiation. And earlier in May, we had the foreign minister from Israel visit South Korea, and during diverse occasions, we also discussed such means, and based on such efforts, we have agreed on such a vaccine swap deal. And here are some measures on how we will be utilizing these vaccines that will be provided by Israel. And as for the 700,000 doses of Pfizer vaccines from Israel, they will be arriving in the early morning of July 7th. And these vaccines have already, the Pfizer vaccines have already been approved here in South Korea, and they are also the same doses that are utilized in Israel for the rollout during the month of July. And upon the completion, we will also provide the emergency approval, and we will also have a quality check by our Ministry of Food and Drug Safety, and then the doses will be distributed to the vaccination centers and be utilized immediately. And as for the 700,000 doses of Pfizer vaccines, this also will be used together with the 10 million doses that will be supplied during the month of July, so that we can expedite the speed of vaccination rollout here in South Korea. And first off, we will be focusing on the rollout of the vaccines in the metropolitan area in Seoul and Gyeonggi-do province starting from the 13th. And especially in the Seoul and Gyeonggi-do province, we will also provide 430,000 doses of the Pfizer vaccines because we have the urgency to deal with the rising number of infections. And to this end, the local governments will also discuss and choose which types of jobs workers working at these specific locations will be subject to those vaccines. And also, as for the end of July, we also have the scheduled local authorities' decision to roll out the vaccines. And as for this will also be utilized through the vaccine swap, and we will also expand the number of these vaccine doses which will be available under such a scheme. And as planned, we will also provide the doses to the faculty members of schools and also preschools, and we will also expedite the schedule of these vaccinations to these targeted group, and we will also be rolling out the vaccine starting from the 13th of July, and we will be receiving the early booking for the vaccines. And as for the eligible recipients, we will be providing individual text messages starting from tomorrow. And as for the 700,000 doses of Pfizer vaccine supplied from Israel, we believe that starting from September and October, when we believe that we will have a high level of vaccination rate here in South Korea, we will have the capacity to return these vaccines to Israel. Nevertheless, we are also seeing a shortage in the global supply of vaccines, and the government here in South Korea, we will also be utilizing such vaccine swap deal going forward. And in the fourth quarter, we believe that we have been telling you that we have a sufficient amount of vaccine supplies here in South Korea. And if we have some excessive vaccines, surplus vaccines, we will be providing these vaccine doses to other countries in a proactive manner. Thank you very much.
네. 그럼 백신 교환과 관련된
And as for the Q&As on the vaccine swap deal, we will also open the floor to questions. Please raise your questions if you have any questions regarding the vaccine swap deal. First of all, from 중앙일보, we have Arirang, a journalist.
이스라엘 화이자 백신과 관련해서
In relation to the Pfizer vaccines to be supplied from Israel,
지난달 19일
he had a question. And also the Palestinian government has also received the 90,000 doses of Pfizer vaccines that have been supplied from Israel. However, due to technical issues, the Palestinian government had returned these doses. And as for the vaccine doses that will arrive in South Korea, are they the same doses? Or if not confirmed, how will you respond to such concerns? As for the vaccine swap deal signed between Israel and Palestine, I do not have any further details. However, as for the vaccine doses that have been supplied to Palestine, we believe that this is these different vaccine to be supplied in South Korea. As mentioned before, these vaccine doses that will arrive in South Korea are exactly the same doses that are already being rolled out to the Israeli public. And we believe that we will be exerting our full efforts to ensure safety. And next, as for the eligible recipients, we also have several questions from JTBC. We have Choi Seung-won. In Israel, as for the Pfizer vaccines, which will be supplied from Israel, you said that they will be rolled out to the people who have a high contact with the public. What exactly will be the criteria in selection of these eligible recipients, and what is the age group? And also from 조선일보 Daily, we also have a question. As for the 700,000 doses of Pfizer vaccines to be received from Israel, what is the details of the eligible recipients? And as for the people who have high contact of with the public in terms of their work, they will firstly be supplied to Seoul and Gyeonggi-do province, and depending on the regional outbreak conditions and systems, we will also have the local authorities select their own criteria. So this will be given, such an authority will be given to the local authorities. And as for the details, when they have some details, we will be providing you any details if you have any further plans. And as for the age group, as for those over the age of 50, we also have in plan to roll out the vaccines in July, and we will also consider the vaccines for the younger people which are also are in need of such vaccines immediately. And as for the details for the vaccine rollout, as mentioned earlier, we will be considering the outbreak situation in the metropolitan area. And first of all, we will be providing the 340,000 doses firstly to Seoul City and Gyeonggi-do province. And also, I do not have the exact number off of my head, but the teachers at primary schools and kindergartens and also preschools, we also have the eligible recipients, and we will be expediting the speed and the schedule of the vaccine rollout. And this is how the vaccine doses will be used. And also, as for the rest of the doses, they will be also be open to the local governments, and also they will have the discretion to decide on their own recipients. And also from 한국일보 Daily, we also have similar questions. As for this question, the details are as follows. As for the 700,000 doses of Pfizer vaccine to be supplied from Israel, will all of them be used in Seoul and Gyeonggi-do province? And can you also give us some examples in relation to the jobs that you have mentioned earlier? And as I have mentioned, in Seoul and Gyeonggi-do province, I have said that 140,000 doses will be supplied to these two regions. And nationwide, we also have the scheduled vaccination rate for about 380,000 teachers and also caregivers at preschools and kindergartens. And we believe that they have been scheduled to be provided with the AstraZeneca shots in July. However, we have switched our plan, and we believe that we can give out the vaccines early as possible, and this is our plan as of now. And as for the job categorized as having high contact with the public, they include people like who are cleaning the streets or also working in the retail sector and also delivering packages and goods. And however, we will also be giving these discretion to the local governments by who will be considering their own situation of the outbreak. And we also have about 3 more questions.
Right, there was Chung Young with Tuesday's afternoon briefing, which focused quite a bit on the vaccine swap deal with Israel.
Exactly. So we know more details now on that exchange. So on July 7th, some 700,000 Pfizer doses from Israel are to arrive here in Korea. And that will then need an approval by the drug ministry here in Korea for emergency use. And then the government is expected to use those doses this month to speed up the domestic vaccine drive. So Chung mentioned that this has been happening on the back of diplomatic relations between South Korea and Israel, and the two sides have been holding closed-door meetings regarding this issue. So now the following questions by reporters focused on who is going to be subject to these doses. So it looks like people in the capital Seoul in Gyeonggi-do province, that's where we have the highest number of infections right now, will be subject to this vaccination, and it will be people who have a lot of contact with other people. But Chung did not mention as of yet who those are going to be, but she hinted that people who do have a lot of contact with others are people who clean the streets or work in the retail sector or in the delivery sector. But the decision will be made by local authorities, she stressed.
I see. And of course, we will return the same amount in the autumn, as you said.
Exactly. That will be between September and November.
I see. All right. So thank you very much for that.
My pleasure.
Right. Also, on the local front, Korea is facing a shortage of foreign labor amid the pandemic. Accordingly, in this next report, we'll look into the reasons behind this reality and the possible solutions to address them.
Mr. Yoon Jung-gun is a farmer in his 30s who works at his father's ginseng farm. Yoon also grows apples in his own farm, but he's had to help cultivate his father's ginseng farm as well, owing to a shortage of workers.
지금 장마철이라서 친환경자로 탈피하고 있습니다. 지금 일손이 부족하다 보니까 지금 제 일도 해야 되는데 이제 아버지 일 도와드리러 이렇게 인삼밭에 나와 있습니다.
Yoon worked with 3 or 4 migrant farmhands prior to the pandemic, but he only has 1 laborer working with him this year.
원래는 이렇게 두 팀으로 나눠서 4명이서 같이 일했었는데 지금 코로나다 보니까 인력 수급이 어려운 상황이라서 지금 2명이 한 팀으로 그냥 한 팀만 지금 같이 하고 있습니다. 그냥 제가 조금 힘들더라도 제가 좀 몸으로 뛰고 있는 상황이에요.
A shortage of migrant workers has become more pronounced across all sectors amid the COVID-19 pandemic. Only around 6,000 migrant workers entered Korea in 2020, a far cry from the 50,000 recorded in 2019, a near 90% decline.
들어오게 되면 또 그 2주간 격리, 또 성축의 상황 이런 것들 때문에 예정된 숫자들보다도 훨씬 더 못 들어오고 있는 상황입니다. 특히 이제 이 취업 비자를 발급받아 놓고도 자국의 상황도 그렇고 또 유입국의 상황에서 입국 제한을 하다 보니까 계속 숫자가 좀 줄어들고 있는데.
Small and medium enterprises have also been hard hit by the shortfalls in foreign labor, threatening to undercut their recovery from the fallout of COVID-19.
이미 작년 6월달, 7월달쯤에 생산 인력이 부족해서 현장에 차질이 생겼다고 응답한 업체가 65% 이상으로 나타났어요. 52시간제가 이제 시작이 되면서 근로자를 사실은 더 뽑아야 돼요. 지금보다 더 뽑아야 되는데 내공인 근로자를 뽑기도 쉽지 않은 상황이고 외국인 근로자를 대체하는 건 거의 불가능한 상황이기 때문에 현장에서의 인력난은 쉽게 해소될 것 같지는 않다.
Korea is far from alone in its struggle to find labor, with many countries around the world being confronted by the same challenges since the pandemic began.
Until the pandemic is controlled, until there is an effective vaccine rollout, labor migration flows will not resume to the extent that they were before in 2019. That is because of the public health measures like quarantine, which adds to the migration costs quite significantly, and also the movement restrictions. So it really depends on the control of the pandemic and effective vaccine rollout.
To remedy this issue, the Korean government announced plans to extend work visas for migrant workers by another year, while prioritizing small and medium enterprises in the allocation of foreign labor. The government is also looking to protect migrant workers by thoroughly inspecting safety measures at workplaces with living accommodations for foreign laborers.
백신을 맞고 국가가 확대가 되고 또 입국 인원이 늘어나고 들어오면은 격리를 또 해야 되잖아요. 그 자가격리 시설을 많이 확충할 필요가 있다. 이분들에 대한 방역을 하는 것이 결국 우리 국민들을 또 위하는 것이기도 하기 때문에 같이 고려할 필요가 있다라고 보고 있습니다.
Korea must find a way to address its labor shortages amid the pandemic in order to keep the country's economy on a steady recovery track post-pandemic.
It's been shown now that we just cannot continue to rely on vaccines that are made outside of Africa because they never come, they never arrive on time.
世卫组织呢，已经将中国的有关疫苗批准列入了紧急使用清单，充分证明中国的有关疫苗的和技术路线的安全性和有效性。
Fears over variants and concerns over vaccine shortages have prompted a number of developing countries to take matters into their own hands by developing their own supplies. For more on this endeavour, I have Professor Yu Byung-wook from Suncheon University. Good to see you again, Professor Yu. And joining this session virtually is Rastin Radva over in Iran. Welcome back, Rastin.
Thank you, Sunny.
And I also have Rick Glauert over in Taiwan. Hello, Rick.
Hi.
Right, we'll start here in the studio then. Professor Yu, as mentioned earlier in the program, Korea and Israel have signed a vaccine swap deal with authorities both here and in Israel, calling it a win-win arrangement. What do you make of this deal?
Well, swapping. So usually we do the swapping because of the cash matter. Who a country is have a crisis or shortage of the US dollars. Sometimes this is swapping, the currency system can protect their economic and financial systems. But this time, some country a little bit temporary shortage of a certain type of vaccination. We receive first and we give it back later. So now certain percentile of Israel, they're good enough to inoculate the whole nation in Israel, but they're looking for some partner, which is the need to share and the swapping is later. So Korea will be the good partner this moment because we're waiting for Pfizer 1 for so our younger people who are going to vaccinate this month. And whenever we receive the Pfizer 1 from US, we give it back to certain time later. Right. So I would, one of the goods, the win-win choice.
Right. All right then, Professor Yu, what can you tell us now about the spread of the Delta variant in developing nations and their efforts to procure COVID-19 vaccines?
Well, since the beginning of the COVID-19 crisis, I'm always saying only one word. we are global citizens. There are no border. There are no discrimination for each other. Our human beings should be living together. So some countries try to block to the border, and some nations say we are fully inoculated and we are free, but it doesn't work because we are all connected. So now the Delta variant shows us even you do your best to inoculate it for your peoples, only it doesn't work. We have to share all the inoculation program with our neighbor countries and the third country who never have enough the vaccines. We start to share. If we not do that, because like North Hemisphere, we are done well, but South Hemisphere crisis passed to the when we have North Hemisphere country have the winter season. So we work forward together, fight against COVID-19 together, not individually, not separately.
Right, we need to work as a global nation then. Rustin, I believe Iran has granted the green light to 2 locally produced vaccines. This was last month, of course. Now, first then, do give us some background information behind this initiative.
Sure. In the past few days, Mr. Namaki, Minister of Health, talked about the emergency usage of Pasteur vaccine, the second national vaccine, which has been made in a cooperation with Cuba. Now, Pasteur is the second Iranian-made vaccine, first one being Co-Iran, which is being injected into people in some cities. The unveiling of the collection of national-made vaccine is when most of the reservoir for the vaccines in the country is empty. And most people who have received the first dose have not gotten their second injection. This has caused a panic between the people and has worried the elderly quite a lot. Maybe this is what caused Iran to start the production of domestic vaccines, so the lack of foreign vaccine wouldn't be noticed.
Right. Rick, Taiwan is also looking to issue emergency use approval to 2 vaccines in development there. Could you please tell us a bit about them?
Yep, so in its bid to vaccinate our population of 23 million here, Taiwan's government has ordered 5 million doses each from 2 local pharmaceutical firms here in Taiwan. That's Medigen, Vaccine Biologics, and United Biomedical Incorporated. These are both protein subunit vaccines, so they're considered really safe as it's an established traditional technology. But there is still a question mark around their efficacy, and they may not prove as effective as the internationally distributed vaccines such as AZ, Moderna, Pfizer, and Johnson & Johnson. Both of these companies have now conducted phase 2 trials, and they've applied to the government for emergency use authorization so they can begin the rollout. So Taiwan has said it wants to vaccinate 60% of its population with at least 1 shot by October, and we're currently at about 10% of the population having received 1 shot.
I see. And before we go into further detail with the situation in Taiwan, Professor Yu, what are your thoughts on these vaccine development efforts by developing nations?
Well, I hope not, but this pandemic can goes at least 3 to 5 years. So we are depending on the pharmacological company like the Moderna and Pfizer and AstraZeneca, but each country, they have own technology can be developed. So we can do the second and third phase of clinical trials. Now we're undergoing in Korea as well. But this means we can recall back the year 2009. That time, we don't have prepared Korean-made, Korean-marked flu vaccination. It's under the clinical trial. But now we have it also. Each country, they have their own flu vaccination, which means if we develop it to each nation to COVID-19 vaccination, yes, some leading countries to protect their country first, and then share, instead to say, their neighbor countries to protect together. So we have to prepare for any phase can be the prolonged, I hope not to last 3 to 5 years. So next new product will be the better than first generation like the Moderna, Pfizer, and AstraZeneca one. This is each country like the Iran, Korea, and other countries try to make their own vaccination, but not approved yet by the WHO and others. But we have to try it to protect not only but their own people and their neighbors' country too.
Right. Right. And Professor Yu, speaking about the WHO, some COVID-19 vaccines are on the WHO's list, while others, like Russia's Sputnik V and Cuba's Al-Badala, I believe, are not on that list. What can you tell us about the protocol with regard to approval for vaccines, for COVID-19 vaccines, by the WHO?
What a coincidence. Yesterday, I've been asked by my patient the same thing, because he came from Russia. But as you know, Korean FDA and American FDA, they are very similar to process of the approval of medication. But if we have it, very unique ingredients only available in Korea, so we need the process to approve in Korean FDA, but after a certain time, we'll pass to the American FDA and the other authorities, health authorities in the world. It takes time. So this time is kind of crisis. We are combating in the world situation. So we should respect each country because they did the clinical trial with their own peoples. The Russian companies do with the Russian people, Cuba do Cubanian peoples. So with their responsible. And then we get the evidence and we do accept this is a trial. I believe so each country should accept their process. So WHO not approved yet, but this is one of the good way they make their own people can protect it. So it's my personal opinion, we should accept and approve about it.
Right. Meanwhile, Rustin, Iran's Supreme Leader Ayatollah Ali Khamenei received the first dose of the homemade vaccine on state television late last month. Now, no data has been published on the safety or efficacy, that is, of the COVID-Iran Barakat vaccine, but what has been shared by authorities about the efficacy of this vaccine?
Government officials claim that the human testing stage has been successful and the vaccine is approved by the Food and Drug Administration. There are independent committees that are responsible for recording side effects for the vaccines, and so far there has not been a worrying case. Based on reports, the Iranian vaccine is still immune against the new variant. And while there is no other option, it seems like it's the best thing that people can get in the country now.
I see. Rick, I hear Taiwanese authorities are seeking a shortcut with regard to the approval process that would allow locally produced vaccines to be rolled out before the completion of final testing. What is the public response to this?
Yep, as you said, both of the Taiwan-made vaccines I mentioned earlier hope to be granted emergency use authorization, which would allow them to skip phase 3 trials and start vaccinations as soon as possible. Though they have said they will conduct the phase 3 trials alongside the rollout. Yeah, it's highly political. We even saw a member of the committee overseeing vaccine use quitting his position over the shortcut and saying to the government that this was just for political gain. In terms of how the public feel about it, I actually have a poll here from the Taiwanese Public Opinion Foundation. They found that in June, 47% of people they polled opposed the government's plan to allow this shortcut, while only 37% agreed with it. Likewise, 61% of people polled said they would prefer to receive an international vaccine, such as AZ, Moderna, Pfizer, or Johnson & Johnson, while only 30% said they would opt for the local option. Finally, 42% of people said they would be unwilling to take a Taiwan domestic vaccine if it was the only option available.
I see. Professor Yu, even for vaccines that have been approved by the global health body, there's still questions about their efficacy, especially with regard to the Delta variant. What are your thoughts on this?
Well, what is mentioned, I would like to welcome the new vaccine release from the Iran. So we already have the many countries that received the Sinovac is like the Chinese-made one, but I believe the variant one is not too properly we can depend with the classic, the first generation of vaccine I like to call about it, but still it's working because more than 50% is enough to cover and protect yourself. So we can call better than nothing. So it's not approved yet, but I respect that each country, they have own process to get the clinical trial to try to save their own people's are. So I believe not approved yet, but it's still working.
Professor Yu, how do you respond to calls for a new framework of consensus with regard to COVID-19 vaccines amid the reopening of air travel, that is, instead of simply relying on WHO standards?
Well, so in Korea, we tried to open it, but we are now suspended. So we are open the border is not only can do the only one countries. We need a partnership and the correspondence to responsible for each other. So I believe we need more time to go to open each border one by one. But WHO, they approved a certain vaccination with a certain standard international guidelines. Yes, but I wish WHO will open and inspect the other product and more local options and try to open it. Why? That help to inoculations matter will be developed more to the each country. For example, if Taiwanese the successful launch well, also Korean one also successful launch well, and fully inoculated all their countries' peoples, and then we give them to some country they need, we can donate it to working together. I'm insisting only one word, we are global citizen. If one country completed second doses or complete one, it's like the Janssen and Janssen. But if you do 100% on only one country, cannot overcome.
Right. Rustin, what has been the Iranian response to the vaccine development there, and what lies ahead with regard to the country's inoculation campaign?
Currently, the vaccination is going very slowly. I believe people want more Iranians vaccinated when there are a lot of people dying every day because of the virus. Before hearing the news of the vaccine being exported or stories like that, field reports in vaccination centers suggest that people would rather getting the foreign vaccine. But I believe with time and proof of the Iranian vaccine working, people will start trusting it more and be more satisfied with it.
Right. And Rick, what are the tasks ahead for Taiwan with regard to its vaccination drive?
I think two things need to be said about Taiwan's vaccine situation. The first is that we've had very few domestic cases here until May this year. So Taiwan has been somewhat late to the table in sorting out vaccines for the country simply because there wasn't any demand for them. The second important point is that China has been working very hard to block vaccine deals made by Taiwan and has criticized other countries from giving vaccines to Taiwan. That said, internationally made vaccines continue to come to the country in a steady stream, and I saw local media reports today that 600,000 will be arriving tomorrow and another 1.1 million on Thursday. This weekend, we also had reports that big Taiwan companies, Foxconn and TSMC, that's Taiwan Semiconductor Manufacturing Company, have secured 10 million doses of AZ and Moderna. And this is a way to get around China's bullying, allowing private companies to deal directly with Chinese distributors. Adding in the locally made vaccines we discussed earlier, it should be possible for Taiwan to vaccinate the whole population. But like many places around the world, one problem the government faces is to combat vaccine hesitancy, particularly as community cases drop off. We only had around 30 new cases yesterday, for example, so there's not such a need to be vaccinated. So the government will need to continue to combat misinformation about side effects and to encourage people to get out there and take their jabs.
What measures are in place in Taiwan, Rick, with regard to controlling the latest outbreak then?
We're at a level 3 on our 4-tier system for controlling the virus here, epidemic prevention. So we have sort of a semi-lockdown in throughout the country at the moment, where dining is prohibited indoors, where most services such as swimming pools, gyms, they've all been closed. We're encouraged to stay indoors. It's forbidden to meet more than 5 people inside and 10 people outside. At the same time, most people have been encouraged to work from home and not go to the office unless it's strictly necessary, yeah.
Right, limits on social gatherings, which we have them too here in Korea. Meanwhile, Professor Yu, Korea is looking to launch its own stage 3 trials for its own vaccines. What are some takeaways for Korea from experiences of countries that are already developing their own vaccines, like Iran and Taiwan?
Well, Korea, we need more time to go because we don't have any of the bases, so like a messenger RNA one. But fortunately, we have the system and the factories can be developed like the Novavax and the conjugated Taiwan and the virus vector Taiwan. So fortunately, now we are undergoing to the second phase in the third phase of trial. The problem is we need a volunteer to do approved domestic vaccination. I'm ready to go, not as doctor, as a volunteer to receive the vaccine, because I believe that. So I'm sacrificing one my needle to hurt my arm and withdrawing my blood. We will prove is working on it. I believe that saved more people, not as doctor, as a volunteer. Korean people, we are ready to go. So actually, the IBI and the many, the pharmaceutical manufacturers, we are doing to try to looking for the global citizen, not only for Korean. So Korea, if we can do the leading countries about vaccination, I would say the welcome. But we have to learning for like Iran and other countries already successfully done in their own domestic way. We can learning. But my last word should be, we need the volunteer to have a vaccination trial. So me and the others, we are ready to go to show that it's working. And our small sacrifice help the people have it safely and relief with the vaccination. So we're ready to go.
Right. Thank you very much for your words, Professor Yu, as always. Rick and Rustin, thank you very much for your time and your thoughts as well.
Thank you.
Thank you, Sunny.
Right. Well, authorities here believe the recent rebound in infections is looking to spread outside of the capital area as well. So do seek to abide by all safety measures. Thank you for watching.